I'm Dr. Cherryl Christensen. I am an occupational medicine physician who began my career many years ago with some time with the United States Navy, working at Norfolk Naval Shipyard, then at the University of Cincinnati College of Medicine in the field of occupational environmental medicine, the Kettering Lab, and then for the next 27 years with the Procter Gamble Corporation, with my career culminating in my role as their global medical director. I think the most profound experience I was able to have at P&G, there were many, but this one in particular was the idea of generating a culture of health and how we could possibly do that. This happens to be a very big company in over 60 countries, etc. So how to do that was quite a challenge. And we set out on this path knowing it was going to take a while because there was no roadmap that had been proven to be successful in front of us. We talked to our employees and wanted to feel their thoughts about their health, any issues, any thoughts, where were they with it? And of course, with our company leadership, because they were going to need to be fully engaged as we moved ahead. So once we felt we had a pretty good understanding of that, we began the path of getting our multidisciplinary team together, which included myself as the medical leader, in addition to our HR resources, legal resources, public affairs. We knew we needed to bring all our best thoughts to this if it was to work. And once we had that plan together, we realized we needed to have some very simple, understandable, critical metrics in place to begin to measure and get enrollment, and really passionate enrollment from our company leadership. So we did that. And what we wanted to do was to increase our overall employee health. And we knew it was going to take time, but we knew there was a crying need for that amongst our employees and also amongst the data internally that we had looked at. We also wanted to increase overall feeling of wellness, which we believe would increase our employee engagement. And then over time, we expected to see a decrease in healthcare costs, not just in the United States, but around the world. And then along with that, we would see less health-related absences. So there were simple metrics, understandable metrics, and we began the pursuit. And what did we need? We needed to have a name for the culture of health. We needed to have a brand that people would see and understand immediately that the vision of this meant this was health. And so we arranged with our internal resources to develop what was right for us as a company, what was right for our culture. Because of course each company has their very own special, just like each family and each person does, their own way of doing things. And so we need to understand that even better. And once we had our arms around that, we began the communication, relentless communication. What are we doing? Why are we doing it? Why are we doing it now? What can you expect to hear from us? And that was the beginning of it.